Tucked in.
Okay, I'm here with Jamie Kotwitz, and I'm going to do her neuro assessment. And so first I'm going to do, just go in and introduce myself. Good morning, Jamie. I'm Robin, and I'm here to do your neuro assessment.
Hello.
Hi. I'm going to begin by taking my pen light, and I'm going to check your pupils. And in doing this, I'm looking for a reaction. I'm looking at both eyes, what they're doing as well. Okay, and she does react. I also saw Jamie blink her eyes. While we're at this, I do see that her pupils are equal. They react to light, they are round, and I'm going to check her accommodation. So Jamie, if you would look at this pen light, please. Now look up and back. Okay, over here. Okay, very good. And she does have accommodation. Can you state your name and date of birth?
Jamie Kotwitz, 3/7 of 86.
And what season are we in?
It is fall. How to think about it.
Where are you right now?
I'm in CMC.
Okay.
Nursing room.
Yeah.
RN room.
Yeah. Can you tell me where you went to elementary school?
Rissler Elementary.
And who is our current president?
Trump. I have an exam. I'm sorry. I'm really got out of stimulation. I'm tired, so
Okay.
maybe a little slow.
And from asking these questions, I see that my patient is oriented, so I can give her the appropriate verbal score of 5. I failed to mention with her eyes, with how she responded, she does give the appropriate score of 4. Both of those are the top scores for those 2 items. And I noticed as I've been conversing with Jamie that her speech is appropriate. She's not slurring. It's not a slow process. Jamie, with your right hand, would you touch the top of your head? And with your left hand, would you touch your right elbow? Okay, you put both hands down. Okay, turn your head to the right. Okay, and my patient obeys commands. You can go ahead and look forward. So I give the appropriate motor response of 6. So her total Glasgow Coma scale, which is 15, which is the highest number. My patient is sitting straight. She's supporting herself. She's well groomed. She has a bright affect. Are you in any pain right now?
No.
Okay. I took my patient's vital signs prior to starting this, recording this video, and her temperature was 98.6, blood pressure 120/80, heart rate of 85. Her SpO2 is 99% on room air, and her respirations were at 20. So my patient has appropriate speech pattern, and her vital signs are all good. Okay, I'm now going to perform the Romberg test with you, Jamie. If you would please stand with your feet together and your eyes open. What I'm looking for is I'm looking to see, do I see any swaying or balance issues right now, which I don't. Jamie, if you would go ahead and close your eyes. And we're doing this for about 30 seconds, and I'm once again looking. Do I see any swaying? Do I see any balance issues, of which I do not? You can go ahead and open your eyes, Jamie. Next, I want to check your pronator drift. So if you would stand as you are and put your arms straight out, palms up, like this. Okay, close your eyes. And I see that it comes back. And I see that it comes back. You can open your eyes now. Okay. And so she's testing negative. And I watched Jamie walk into the room today, and I observed her gait. She took even steps. She did not shuffle. Her balance was appropriate. Her stance is appropriate. She has good posture standing. And I was observing, I did not see any tics, no musculoskeletal deformity. And then I'm going to observe her muscle tone with some passive range of motion exercises to see how she does. I can do her arms, I could do the other arm, and then I could do the same thing with her legs for the sake of time. I won't go ahead and do that. And she's not rigid, she's not spastic, there's no contractures present, and she's not flaccid. So testing muscle strength, and there's different ways we can do this, but what I'm going to do, I want you to go ahead and place your fingers apart, and I want you to resist. I'm going to try to pull them together, and you try to not let them come together. Okay, and she is putting pressure, and then you can go ahead and put your hands together, like at your side. I'm going to go, sorry, okay, and I'm going to press down, and she has that resistance, and I press up. I can do the same thing with her arms. and she's resisting. I can do that very same thing with her feet, with the plantar and dorsiflexion. I can do that with at the back of her heels to be able to go ahead and assess those things. You can also assess the hips, but her muscle tone is great. I go ahead and I give it a 5. Let's go ahead and check your groups. Would you please? Oh, I'm sorry, I'm in the way of the camera. Okay, if you would reach up and grasp my hands as hard as you can and squeeze. Very good. All right. You can go ahead and have a seat. I want to go ahead and check your sensation. Okay, if you would close your eyes, please. Okay, where am I touching you?
My right cheek, my forehead, my chin.
Okay, and I could go ahead once again and move on down toward the body. And this is important for different disease processes. I could do the hands. We think of someone with diabetes and their neuropathy. This is an important test so that we can check for their sensation to be able to feel. Next, I want to check Jamie's balance. So if you could stand up, and I want you to walk in a straight line, heel to toe, about 3 or 4 steps. She does that, fine. All right, and then she's going backwards. And I could go ahead and I could ask her to walk on her heels. I could ask her to walk on her toes. If I wanted to go ahead and do some more assessment. The other thing I would do is check her reflexes. If you want to go ahead and have a seat. A couple places I can check her reflexes. If I go this way and I bend her arm and I would take the little mallet and I would tap, tap, and her arm would come out with a normal reflex. I could do that on both sides. Also, I could go ahead and do it at the knee, and go tap, tap, and her leg goes out. I would do that with both sides as well. All right, and then she would have her reflexes. Next, I'm going to check her cranial nerves. So at this point, I'm going to pretend I have a substance, and I would go ahead and have her close one side of her nose with your finger, and I would hold this substance up. In this case, she would smell it, and she would tell me appropriately that she would be smelling coffee. And then we would go ahead and do the other side, and I could try a different smell. And then that was her olfactory. That's optic nerve 1. Optic nerve 2 is the ability to read. I could use the Snellen eye chart, or I could give her something to read, something simple, like a little paragraph or a few sentences from a book, and let her go ahead and read those for me. To know she was able to see those words. Ocular motor 3, cranial nerve 3, I already did that. I checked her pupils. I shined the light on them to make sure that they both contracted the way they should. And then cranial nerve 4, and that is to check the trochlear movement. And if you would go ahead and look down, and look to your right, look to your left, look up, and I can see that her eyes are moving out. Trigeminal is where I want you to hold your mouth open, and I'm going to try to close it. And this is cranial nerve 5, and she's putting her resistance there. And we already did this where she would touch her face. I would touch her face, and she would identify where it was touched. The other thing I want to do is I want to check her eyes for those reflexes, and I would have liquid tears is what I would prefer versus a piece of cotton. And I would have her tip her head back, and I would, just like putting an eye drop in anyone's eye, I would go ahead and I would pull down and I would put that drop in, and I would look for that blinking sensation, and I would do that on both of those eyes. Cranial nerve 6. And I already did that one. I had her move side to side. Her facial. Would you please smile for me? This is cranial nerve 7. Would you raise your eyebrows? Okay, I want you to keep your eyes and lips closed. And I will try to open them carefully. She keeps them closed. She keeps her lips closed. Okay, you can go ahead and open your eyes now. Next thing I'm going to do is cranial nerve 8, which is the acoustic, and I'm going to whisper, have her cover her right ear, and I'm going to whisper, cover your right ear, and I'm going to whisper in your left ear, and you tell me what you hear.
Applesauce.
I'm going to have her cover her left ear, and I'm going to whisper a word in her ear.
Banana.
Very good. All right, next is cranial nerve 9. And I would get a tongue depressor, and I would have her open her mouth, and I would have her swallow, and I would be looking. I want to look at the uvula. I want to look at the soft palate. I want to see if there's movement there. Cranial nerve 10, I would assess her gag reflex by putting that back and see if she gagged. I would also be able to assess her swallowing, and then assess her vocal quality. Cranial nerve 11 is the spinal accessory. So what I want you to do is shrug your shoulders. I want you to turn your head from side to side. Okay? She's able to do that just fine. And then cranial nerve 12 is I want you to stick out your tongue, which she can do. I want you to move your tongue internally from cheek to cheek. Can you touch each inside? Can you touch each side of the inside of your cheek? And she's able to do that fine. Another thing I did not mention in the assessment is the symmetry of her body. I see symmetry of her face. Both her sides of her body are functioning equally well. And this concludes my neuro assessment.